We are running behind a little bit, but I am going to ask Dr. Clarke to do his presentation now, and we'll have tea after that. Dr. Charles Clarke, one of the UK's most eminent mountaineers, has been on a number of expeditions in the Himalaya. He first came to India in 1962, and it's a great privilege to have him here. I think the resident probably needed him at every turn there. He's a specialist in high altitude medicine, as well as being a mountaineer, and he's going to talk to us today about jewels of Tibetan medicine. So welcome.
Lovely, thank you very much. Now, I'll thank you. Now for something slightly different. Ganesha's told us about history of Mussoorie. We've heard about the problems of high altitude. I'm going to turn the clock back about 500 years. And you know all this. This is how I began climbing in 1955 with a single snake climbing in North Wales, but I soon moved on to Everest and Kishtwar and many other places, Swagrahini around the corner. But the last 10 years of my climbing career took place in eastern Tibet, and in the background there, sorry I don't have a pointer, you'll see a big mountain that's called Sepu Kangri. And I spent many years trying to climb Sepu Kangri with others, and there it is, just northeast of Lhasa, between Lhasa and Chamdo in the eastern Yangtze Handbag. Now, it would be easy to talk about climbing, but I'm not going to. I'm going to talk about an offshoot of my interest in Tibet. There's the Basildon Palace. Here are the icy roads of central Tibet, and the sorts of journeys that we took, that I took between 1996 and 2000, when we found Sepu Kangri just under 7,000 meters and attempted to climb it. But an offshoot of this was that we were living with many Tibetan villagers, traveling through the monasteries of eastern Tibet, which many of them thriving, attending things like this devil dance meeting and treating local people, seeing their babies, meeting the local hermit and so on. And I became interested not only in practicing medicine, but how medicine is practiced. And I read about this professor in Tibet's Secret Mountain, and this lecture is a little facet of that journey, and it is about the medical teaching tankas, the traditional Tibetan paintings that were made in the 16th century and have remained much as they have been until the present time. And they follow a general Buddhist pattern that you can see here. And I'll take you through some facets of these. I'm not going to talk about herbs particularly, and as I'm a modern doctor, treatments that have been shown not to work, but I'm going to talk about the attitudes of traditional medicine. And the, whoops, can you go back to me? Sorry, I want to go forward. I want to go forward. We've got to forget. The Tibetans, here we go. The Tibetans lacked reticence. You understand from the Tibetan medical tankas exactly what treatments are being talked about. Here's an enema being carried out. And by the 12th century, they had a full armamentarium of tools to carry out operations on the abdomen, on the bladder, the eye. They thought about the circulation of the blood long before it had been questioned in Europe. The traditional Tibetan medical hospital stood here on a hill just opposite the Basildon Palace. In the Cultural Revolution, it was razed to the ground by the Tibetan Red Guards. And the story I was told, which I believe, is that the Red Army preserved the Tibetan tankas. And this is the sort of thing that you see. The shape of a tree, And this is the tree of diagnosis, and it has a stem first on the left of interrogation and taking a clinical history. In the middle, the stem of inspection, what you see when you look at the patient. And thirdly, the stem of palpation or examination. Now remember, this is 1600, and in Europe, there was nothing like this